You want them to finish reading that essay and want to call you for an interview. Good evening. Welcome to eShadowing, guys. Hey, guys. Sorry I'm a little late. Welcome. Hey. How's everyone doing tonight or this evening? Happy Memorial Day. Hope everybody had a great holiday. Alrighty. So we're going to get started. I'm the guest and the host, I guess, this evening. I'm going to be speaking tonight. So if you guys didn't tune in Friday, well, Friday was National Pre-Med Day with medical school headquarters, and I was on there speaking. I discussed the top 10 pre-PA frequently asked questions. I'm sure like a lot of you probably didn't tune in. If you did, great. But I wanted to actually spend some time actually going over that since they're frequently asked questions. So I'm going to spend some time doing that, or the bulk of our session today is going to be on that. And I'm going to try to go a little bit more in depth in explaining this since you guys are all pre-PA students. So we're going to get started. And if you guys have any questions, of course, put it in the comment box. I'll spend some time answering questions as well. Please keep it general, like not personal questions or too personal questions. If you do have personal questions, feel free to email or DM me. But yeah, keep it as general as possible if you can, not too personal. But yeah, I'll answer questions towards the end of the session. Okay, somebody said, what are great interview tips you may have other than being yourself? Questions to ask the interviewer. That's a great question. Of course, you want to ask about the school, about the program. Let me see, because I'm trying to think about like what they're going to ask you, and then what you're going to ask in return. I always say, of course, if the school's on like a probationary status or they may lose accreditation, always ask about that. Ask about anything that concerns you about the school, but don't do it in like a threatening manner or like you're belittling the program. Ask it in a more concerning tone, or like you're very interested, but you just want to make sure that, oh, it's okay. So yeah, just if you ask any question, just make sure you watch how you ask the question per se, not necessarily. Of course, you don't want to ask anything like that's irrelevant or irrelevant to the school. But yeah, make sure you do your research on the school. If they're focused on community service, or if they're focused on serving the underserved, if they're in a large, if they're within a community that's big on low income. For low income population, then ask about that. Ask about job opportunities possibly after PA school, or how they help if they help students get placed in underserved areas, or primary care opportunities. Whatever they're big on, whatever their motto is, or whatever, and that shows that you've actually done your research and interested as well. But ask anything that concerns you about the school. Are you involved in resuscitations? It's not necessarily being involved in resuscitations. Sorry, I was just reading another question, guys. So I hope I answered that question about the interview well. But somebody said, what is your role in the ER, and are you involved in resuscitations? My role in the ER is as a PA. I basically do just about like everything as far as my scope, just almost everything. I would probably say like I can see like 90% of patients, 80 to 90% of patient complaints. As far as resuscitations, I wouldn't necessarily say because there's doctors readily available, they usually run the codes. I'll be there to help, like doing chest compressions, passing equipment, whatever they need, helping the nurses out. I'm more so like just kind of a utilitarian role, just kind of helping wherever I can. So as I said, this ER, there's a trauma critical area strictly reserved for trauma and critical care patients. The PAs usually see the trauma patients or the trauma patients that are stable and, kind of level 3s, level 4s. And then the doctor would see critical care patients. So critical care is just kind of like level 2, level 1s. So that's where codes come in. Codes go straight to the trauma critical care area, and the PAs are there too. So they're there to help if they need, if need be. But the doctors are usually the ones running the codes. But if you work in the ICU and you practice very independently, your attending trusts you, I've seen PAs run codes there too. And then if you work in an underserved area and it's a very small area, well, not even necessarily underserved, but I mean, typically underserved areas can be very small hospitals, or some of the hospitals are very small, like rural areas. So I once worked in a rural area and it was like a 9-bed ER. So it was just one doctor and one PA at a time. And I was the one PA. So if the doctor was busy running one code and another code came in, then I would have had to do that, and I would have had to run that code. Thankfully, that never happened because that was like my first job as a PA. Well, my first ER job. But yeah, if you're in a very rural, small ER, you may be the one doing it, since it just may be you and a physician. Yeah, if you respond to trauma codes in the ICU as a respiratory therapist, that's awesome. Yeah, do you ever see level 2s? Yes, I see anywhere from level 2 to level 3s. Level 2s are typically more stable level 2s. Like sometimes a patient with, and it'll depend on their vitals. Like sometimes if a patient has DKA and their vitals are crazy, but they're like still like it's something a PA can treat, then I'll see that. Okay, so I was able to save it as a PDF. I just as far as that presentation, typically I don't mind sharing my screen, but I want to be able to look at the chat box. If I share my screen, then I won't be able to see the chat. So that's why I wanted to do that. Somebody said, in general, do PAs have more work-life balance than doctors, or is this an assumption that can change based on the specialty or environment? People like, okay, I think your second, the second part of your question is more correct than the other. Okay, yeah, I think PAs typically do have a better work-life balance, just because they're not saying that doctors have more of that responsibility, but and then if a doctor is running an office, they're gonna have to stay longer. But it really depends on, I would say, the specialty or environment, because I have PAs that work in surgery or work in orthopedic surgery, especially. Orthopedic surgery is just insane. Like one of my friends did that, and they said they had like no work-life balance. And it really depends on where you work. Like say they have really bad staffing and they really need you, or if you're on call all the time just because it's really busy, then your work-life balance may be a little poor. I feel like office jobs like urgent cares, ERs not office, but urgent cares, primary care, the work-life balance is better as opposed to like jobs where you're on call, like surgery, or even sometimes travel jobs. Well, travel jobs you can make your own schedule. But yeah, I think PAs generally have a better work-life balance, but it can really depend on where you work or the type of work you do. Does being a CNA offer good work experience, or should I work on being an LVN? No, being a CNA offers great work experience. And I'm going to discuss that in my presentation. All right, so as I said, I presented at National Pre-Med Day on Friday, and I really wanted to discuss this specifically with you guys, as this is for pre-PA students. It's the top 10 frequently asked pre-PA questions. So we're gonna get right into it. These are questions that have been asked by so many students, email, DM questions, and so I'm gonna give you guys some advice and feedback that I typically give students that ask me these questions. All right. And then This is probably like, I mean, I was asked this today. So one of the top questions I get asked is the best way to get patient care experience. So in order to get patient care experience, you have to know what it is. And not one is necessarily better than the other. A lot of people like to say, nursing is the next best thing to PA. Or not, or I guess PA, because you're going to have a bachelor's degree, you're going to do so much. You would do so much as a nurse, like as an RN, but you don't have to go back to school to get your RN. If you happen to be a nurse before PA school, sure, but it's not necessary. There's tons of ways to get healthcare. Like somebody asked me if they can do CNA, or should they go and get their LVN. No, CNA is great. Patient care experience is hands-on, directly involved in the care team, like in the care of that patient. You're touching that patient, interacting with the patient, you're caring for that patient some way, somehow, whether it's taking vitals, changing them, whatever it may be, you're directly involved. Think of direct involvement. So some of these are CNA, medical assistant, patient care tech, EMT, LPN or RN, home health aide, EKG tech, or scribe. I put scribe there, even though it's not hands-on or directly involved. I put scribe there because I really, really like scribe. I think it's a great way to prepare you for PA school, especially when it comes to the documentation. Like, you learn how to chart so well being a scribe, because that's all you do. You basically do the notes for the provider, but a lot of schools don't count it because you're not like directly speaking to the patient. You're just kind of there in the background, but you learn so much because you're seeing everything. But some schools do count it. I think a lot of schools are possibly starting to lean more towards it. I know Emory likes scribes. Nova takes scribes. Emory's in Georgia, Nova's in Florida. Although some schools don't, I personally like scribes because of the immense information that you learn or experience that you get. But the others that I listed are definitely, without a doubt, patient care experience. And what I tell students is that if you're in college, don't stress yourself and try to go back to school and do a 1 or 2 year program or whatever, like to become an LPN or RN. Like, do like a quick certificate program, like CNA, medical assistant. Like, there, a lot of those are like 6 months. Some of them are self-paced, so you can get it as soon as possible. Just get that. It's not your career. Don't stress too much over it. Get it so you can be able to quickly start working and build those hours up, and get your hours that you need to become a PA, which is going to be your actual career. So don't focus so much on, which one should I choose? Which one should I choose? Choose the one that you're going to like. Choose the one that's feasible, that's going to be easy to complete with your busy school schedules, and get out there and get it done. So, yes, I am keep it simple. All about that. All right, how many patient care hours are considered competitive? I would say at least 2,000 hours. And I say this from my own experience, and then also from talking to some admissions personnel from various schools. 2,000 hours is considered competitive. Of course, you want more than that, but 2,000 hours is equivalent to 1 year of full-time work. So say you work 40 hours a week for 52 weeks. That's a little over 2,000 hours. So, and I know that's hard in college. So that's why I tell you guys to choose one of the patient care fields that's going to be right for you, that you can quickly complete, get your certificate, and start working, because it's going to be hard to work full-time as a college student. You may need to start work. It's probably going to be easier if you know your freshman year that you want to go into PA school. You get a job and work part-time for 4 years, and you'll build those hours. Or you can wait until you graduate and work full-time after you graduate, take a gap year, work full-time nonstop, pick up some extra hours and build those hours, or kind of do it, like I said, throughout college. But it's just all based on your life and what you have going on, but try to get at least 2,000 hours. And that's direct patient care experience. This is not shadowing. This is not volunteer. This is just strictly work, paid work. How do I find a PA to shadow in COVID era? Of course, you guys are getting shadowing hours via myself with eShadowing, but I know that it's important to find that PA to shadow because you're going to need a letter of recommendation from that PA. You're going to want one unless you know a PA that knows you well and can attest to, you know, your characteristics and yourself as a person and write that letter of recommendation. Most of the time, that PA recommendation is going to come from shadowing. And you definitely need at least one PA for your application. When I applied on CASPA, I definitely needed at least one PA was required. So I think that's still the case. So you're definitely going to need at least one PA. And I know it's hard with COVID. This is probably like the number one question I've been getting lately. So especially now, students have been asking me for recommendations. I wouldn't think I'm the best person because unless there's a few students that I definitely don't mind because they've built that rapport, and I don't know if they were just kind of strategically doing it or if they actually liked me. But a few students I feel comfortable enough because, you know, they talk to me all the time. They're always DMing me. They're always emailing me. They tell me about themselves. I've gotten to know them. They text me. So I don't, and that this is just from eShadowing. Like since like November, they've just been like in constant contact with me. So I don't mind. But if you really haven't, you're just kind of emailing me, asking me for a letter of recommendation, I'm sorry, but I can't really do that because I don't really know you and I'm not going to get to know you in like a month or two. But if you do need a PA to shadow, I say, of course, utilize your network. If you're part of pre-health clubs, join your pre-health clubs in your schools, get involved with those. There's volunteer opportunities. I'm sure PAs or healthcare providers come to speak during those times. Take that moment to DM them, to ask, well, not DM, but to ask for their emails, start building a rapport. Building a rapport is like the best way. Just kind of squeeze yourself into their little, accessing them and start messaging them, get to know them, and get comfortable with them. So they'll be okay with either mentoring you or shadowing, allowing you to shadow them. So really utilize your network. I'm sure you guys have other PA friends that know PAs, or pre-PA friends that know PAs that shadowed a PA that can help you out. And a big thing right now, you guys know, is social media. Join Facebook groups. There's a bunch of pre-PA and PA Facebook groups. Reach out to people on there. See if there's PAs on there that's in your area that you can shadow. And then LinkedIn, I think, is the best way to actually connect with a PA because it's a professional site. So take advantage of that. Take advantage of, please, I hope you guys are either going to remember this because I get so many emails about this, and I'm so glad that I'm able to discuss this with the masses tonight. But I always say LinkedIn, create a nice professional profile, upload your resume. There's a little about me, highlights yourself, your skills, what the kind of experience you have so far. So when you do reach out to PAs, they can click on your page and read that about you. And of course, I wouldn't say don't send like cold messages like, hey, I'm looking for a PA to shadow. No, you first add them, introduce yourself, add them, say, I'm interested in the PA profession and would just like to, get to know you, given, you're a physician assistant and, I admire, PAs and whatnot. And yeah. And then as time goes on, give it like a week or two, like their page, interact with them a little bit. And then, slowly ease yourself in. And then you say, oh, I'm looking for a PA to shadow. You're in my area, looking to see if you accept. Send that to as many people as you can. And I think you'll eventually be able to find one. Because like I said, back in my day, I used the yellow pages. Social media wasn't like that hype, especially like all these, especially like PAs or professionals on social platforms or building a brand on their platforms. So please take advantage of these that I listed. Your network, pre-health club, social media, Facebook groups, LinkedIn. They're at that, crossroads where they're trying to decide which career path to take on. They want to be a medical provider, but they're not sure which one. So I always say, of course, do all your research all of them. Even if, you're trying to decide on those, but research other ones as well. Research RN, LPN, whatever. Do a bunch of research, watch YouTube videos, read books, get to know these, talk to people in these fields. And that's the best way you're going to learn about them and figure out which one you like over the other. And then, of course, it's also going to be based on your personality, your lifestyle, family, what you want out of life, the type of life you want to live, your work-life balance, how you want to learn, because NPs are taught differently from PAs and MDs. So it's all going to be based on that. And it's probably going to be a little harder to decide on this if you're younger. So if you're like still early in college and still trying to find yourself, you don't have to make a decision right away. You don't have to know what you want to do at this very moment. Take some time to learn yourself and learn about, the type of life that you want for yourself, especially. I think that's the most important out of all of this, the life that you want to live. Whether you want to have a family or not, whether you want kids or not, whether, you want to give time to travel the world, like whether money is big for you or not, like all of that is really, your lifestyle is probably going to be the most important thing, learning the type of life that you want to live. So yeah. And then finances, of course, student loans. A lot of these are more expensive than others. So consider all of these when trying to decide PA versus NP versus MD. And nobody's going to make this decision for you except yourself. Okay. I hope this is helpful. All right. This is another big question that I get asked. And I also explain this with the personal statements that I review. I actually explain this to most people when reviewing their personal statements. And speaking of personal statements, I'm still going over April's statements, guys. I'm so sorry. I got about 8 left for April. I was on vacation and I was just like, I had a lot of emails to respond to, just email inquiries, just questions. And I had to take time to go through those emails. I had a lot of emails. So I just have about 8 more left. I'm off Thursday, so I'm going to try to get through half of them and then the other half my next day off. I'm so sorry, guys. Okay, so a compelling personal statement. Tell your story and get personal. You don't have to get too personal, but be a little vulnerable and tell your story. They want to know who you are. Remember, they read thousands and thousands and thousands of essays a day. Think about how you are going to stand out. You always want to start with a strong introduction. Okay, strong introduction. And then close with a memorable conclusion. Your conclusion should not have you should never introduce anything new in the conclusion. You should always kind of reiterate stuff from your other paragraphs and then close with why you are an asset. Make them remember why you need to be in their program. And I've read quite a few essays where you guys are kind of asking them to accept you, like, would you please give me the opportunity to be in your program? Or can you please give me a chance? And they kind of ended with the question. I'm like, no, you don't want to ever ask them to be in your program. You want to let them know that, yes, listen, I deserve to be in your program. I am an asset. You want to highlight yourself. Don't go asking, oh, I want to be in your program. Can you please let me in? No, you better say, I am this. I am confident. I am resilient. I've been through this and I made it through. I've been through that. Like, I bring this to the table. I have this amount of experience. Like, highlight yourself. You don't have to like list it all, but do it in a way where they're going to be like, dang, this person is bomb. Let me call them up for an interview. You want them to finish reading that essay and want to call you for an interview. The essay is so important. It's probably, to me, the most important thing because of like above grades, above, stats and all that. This is the only way that they will get to know you. They'll get a piece of learning about who you are. And I think that's most important for being a PA, who you are, what type of provider are you going to be? Highlight that, show that in the essay, what type of provider you're going to be. So you always want to start with, make sure you include these points, why you like medicine, why you got into medicine, like, what is it about the medical field? What was that defining moment? Followed by why PA, because all these careers in the medical field. So why did you choose PA? What was that defining moment? And then, these are typically explained in the earlier paragraphs, in the first, second paragraph. And then the bulk of the sandwich, like the third, fourth paragraph, or second, third, fourth paragraph, is going to include things you did and lessons you learned along the way that shaped who you are. And that's also going to highlight your skills. If you volunteered, if you did a missionary work. I love it when students talk about the volunteer work they did, the missionary work they did. The one girl, I read like one of the best personal statements. She explained, how she discussed racial injustices, and explained how she wants to be a PA to change kind of like the narrative and inequities in the healthcare field, and how she traveled the world to get to understand different healthcare disparities within the world and all that. It was an amazing essay. So all of that you want to explain, the shadowing work that you did, or shadowing, your healthcare experience, how you got healthcare experience, and how all of that shaped and prepared you for PA school. That is a bomb essay. Those are the things you want to include. And remember, don't ask. You better tell them. Don't ask to be in the program. Tell them, this is why y'all need me. Okay? Remind them that you are an asset. Please, like a bomb essay is highlighting from paragraph 1 to 5 or 6 why you are an asset. Okay, and make sure you clearly explain that. Don't say I'm an asset, but list all the ways that you are an asset. I hope that helps or helped. And if you guys want this PowerPoint, just let me know. But yeah, an essay, show that you are an asset. Remind them that you are an asset. Don't just ask but explain vividly that you are an asset. That's a great essay. Alrighty. Question 6. How do I ask for a letter of recommendation? This goes along with the question on shadowing. So above anything, I should have actually said to build that rapport. Like I said, you're gonna want to find a PA first to shadow, a PA or MD, but a PA really, the others probably won't have a hard time finding a letter recommendation for like other people, but PA specifically I'm speaking on. But how do I ask for a letter of recommendation? Initially build that rapport with them. Once you do find a PA to shadow, when you're shadowing, build rapport, highlight your skills, and show off. So act interested. Even though, say you got a shadowing opportunity in ENT. That was my shadowing. I didn't like ENT. I didn't want ENT, but I was just grateful that a PA wanted me. A PA allowed me to shadow them. So I did shadowing in ENT because no other PA would take me. So I shadowed an ENT PA, even though I did not like or really care for ENT. I act like I was interested. I asked questions. I asked about what they did. I asked, act like you just make them, be impressed with you. So highlight your skills and show off, build the rapport, and then keep in contact. So if you're not going to apply to PA school for another year, but you're shadowing right now, once you're done shadowing, if you shadow for 6 weeks, 2 months, whatever it is, keep in contact with that person. Get their email, get their number, message them periodically, see how they're doing, let them know, how you're doing, let them know where you are in your journey. Tell them Cassie's going to open some. I'm going to apply to PA school soon. How are you doing? Such and such. Email them periodically so they remember you. So even though a lot of students say, I'm going to apply to PA school next year, but I'm working with a professor now. Should I ask them for a letter of recommendation? No, because that's not even how it works. For CASPA, you're going to need their email, and then CASPA is going to send them a link to go to a specific portal. And the portal has they're first going to ask you questions. The recommender, they're going to ask you questions about that person, and then you're going to submit the letter. So, no, you're not going to get a letter from that person. just like directly. They're going to submit it on CASPA. So that's why I say to keep in contact with that person. Like send them an email every, 1 month, 2 months or so. And so they remember you. So when the time comes, they don't mind. Don't ask for one right after you finish with them and, say, oh, I'm done. I have my letter of recommendation. No, just keep in contact with them so they remember you. And then, or let them know, I'm going to need a letter of recommendation when I get ready to apply to PA school. And then, just like I said, keep in contact. So we're going to discuss getting into PA school with a poor GPA. Although, a competitive GPA is typically, 3.5 and above. They'll accept 3.0. Excuse me. Anything less than 3.0 is really hard, but it doesn't mean it's impossible. So there's different ways to get into PA school and improve your GPA. If your GPA is subpar or not that well, things happen. Don't let anything really, hinder you or make you feel less than or make you feel you can never accomplish a goal. Okay, and that comes with, PA school and anything that you do in life. Okay, there's always going to be ways to improve and to get in as long as you're strategic about it. Okay. There's tons of people that got into PA school with low GPAs, so it doesn't mean that you can't. Okay, so the first thing is to, of course, retake classes. If this is a career change, or you didn't start off well in college, or science is just not your thing, then always just retake the classes you did poorly in. A lot of schools are okay with at least 1 or 2 C's, but they don't like a lot of C's. So if you have a lot of C's, then retake those classes. Some schools don't want you to take classes at a community college, but I don't think anything's wrong with it as long as the school's fine with it, because not only is it easier to learn because it's a smaller class size as compared to larger schools, but sometimes it's professors are sometimes, nicer and, teach better. I mean, I took some of my prereqs at community colleges, and I don't think anything's wrong with it. So sometimes you can do that, and it's cheaper too. So you can take those classes at community colleges online to work around your busy schedule. But the first step is to retake classes you did poorly in, and just buckle down, figure out better studying techniques, and try to do better. If you got a C, aim for a B. If you failed, at least aim for a C. I'm just kidding. Aim for at least a B. But yeah, do that, and then you can do a post-bac versus a master's program. Master's program, you get a degree. Post-bac programs are usually like certificate programs. So those are other ways to help your overall GPA. And of course, to highlight your other strengths. So if your GPA is not that well, but you have like 5,000 hours, that's bomb. Or your GPA is not that great, but you did a ton of research and you discovered something. Who knows? I don't know. Then highlight that. Or you studied abroad, or you did a bunch of missionary work and have, all this experience, or you're worldly. Highlight your other strengths and skills and things that you bring to the table. Not everybody's going to excel academically, and people like that actually aren't good at test taking, they're actually really, really good providers and have really good clinical skills, are really good with procedures. So don't think that just because you're not good at test taking, or you're not good just reading and writing down stuff, that's all boring to you. Some people are better with hands-on learning. So that doesn't mean you won't be a good PA at all. It doesn't mean it at all. So you can still do it. Just do what you got to do to get in. All right. Now question 8. I'm just going to go back to this to make sure you guys are still here. Okay. Okay, so just making sure. All right, the best time to apply to PA school. As far as when to apply to PA school, when you're ready. CASPA opens every April towards like mid to late April. So apply when you are ready, when you feel confident and are ready to apply and start PA school. If you have a whole lot of things going on, it's probably not the best time to apply. If you feel like you still don't know about the PA career and won't excel in the interview, don't apply. It takes some time to learn more. Apply when you're ready. As far as when to submit the application, I say like during the summer months. So you do not have to, actually don't advise you to submit the application right away. Don't submit, if CASPA opens April 26th, don't submit it April 29th, please. You want to thoroughly go over your application. Thoroughly cross your T's and dot your I's and keep going over. Make sure you have just about everything. You don't have to complete all your classes before submitting the application. You generally don't want to have too many classes outstanding. I would say 1 or 2. They want you to finish all your classes by the time you apply. So if you haven't graduated yet, you won't graduate in time to start PA school, then don't apply yet. Apply when you're almost done. Okay, or if you're in the undergrad, I mean, or almost done with your prereqs. Don't apply if you have more than 3 classes left to take. Like as far as like by the time you submit your application. So say you have like 3 or 4 classes left to take in the fall. I wouldn't say it's the best time to apply because a lot of schools probably won't accept you. They'll accept you if you have like 1 or 2 classes because, more likely than not, you'll pass those classes. But if you have 4 classes, it's harder to apply when you have a lot of classes outstanding. So try to finish your prereqs as much as you can. Definitely, of course, you don't have to have all your, I don't remember if you have to have all your letter of recommendations. But definitely make sure your essay is bomb. Take your time to apply. Just take your time. Don't rush to get it in, but make sure you get it in within a reasonable time. So May, June, July. I submitted my application August 31st, 2013. I wouldn't submit it beyond then. I wouldn't submit it in September. As you all may know, a lot of schools have rolling admission. So as soon as CASPA opens, they'll start reading through applications and inviting people for interviews. Some schools will let you know when their interview timeline starts. So they may start interviewing people in June, who knows. But once they start interviewing and accepting people, that's it. They're going to accept them as they interview them. Like for me, I submitted my application August. I got a supplemental application like a few days later or a week later, and I did that right away. And then I got an interview invite like mid-September, and I interviewed October 26th or something, or 25th, like towards the end of October. And I interviewed on a Friday, and then I got the call on a Monday. So if they like you right away, they'll call you and call you to, you invited, you in, you accepted. So, yeah, if they like you, they'll accept you right away. So that's why I say don't wait to apply. Apply no later than August, September. Excuse me. So you can get that interviews because say you apply in September, October, and like I said, I got in October. So if you apply in October and people already got in, they're filling those seats up. So if they only have 60 seats and they've accepted like 15, 20 people by October, your chances of lessening your chances because you applied later. So the earlier you apply, the higher chance you have of getting in. All right. Okay, advice for reapplicants. Okay, so, and I say, as far as a reapplicant, it depends where you were in the application process. Did you get rejected right away? Did you get rejected after the interview? Did you get waitlisted? So that all depends on that. So I say typically if you got rejected after the interview, it could have been your interview skills. So go over your interview skills because they liked you enough to accept you. I mean, it could have been your interview skills and then like other people. Well, I think it really is your interview skills because, they like you enough to, get to know you, to want to meet you. But then, you might have fallen short, or other people might have interviewed better than you, or they might have liked other people more than you, or whatever it is. Of course, not everybody's going to like you, but just really go over where you might have fallen short. Go over your application, go over it. You can even contact the schools. Some schools may not respond, but kind of see, what they advise you to do. kind of gauge, get any advice that they are willing to give to help improve your application for the next time. And like I said, what point did you get rejected? The last slide was preparing for PA school financially. It was just discussing different ways to pay for PA school. And I can send the slides over to you guys. And of course, it's inevitable. You're going to have to take out student loans. PA school is going to be in the upwards of like anywhere from 60 to 80,000 and above, just tuition wise. And of course, if you need more help financially beyond tuition, like maintaining your household, paying for rent, paying for different things, because like I said, you can't work in PA school. It's going to be really hard to work, especially a full-time job. So loans are pretty much inevitable. A lot of people message me and ask me, how to pay for school. I'm just like, you're gonna have to take out student loans. There's more scholarship opportunities, a lot more than before. And I think that's because the PAs, of course, more popularized, and there's a lot of great people in the PA field, like influencers doing a lot of great things and getting involved and creating more opportunities for students, especially financially. So there's different ways to pay for them now, more scholarships. If you follow Jackie, the PA, she's always giving out stuff. The PA platform, there's a ton of PA influencers that post when scholarships are available. I'm trying to get like all of that organized too, and so you guys can know about scholarship opportunities. So there's a lot more scholarships. There's scholarships for minorities. There's not only scholarships but grants. I'm sure you guys know of the opportunities for to work in an underserved area for 2 years, and then they pay us either all your loans off or a certain amount off after if you work for 2 years. I forgot what organization that is, but is there. And of course, your student loans, you're just going to have to chuck it up and get some loans. Somebody said, is this what the broadcast is like every time, like the same content? No, I don't think I discuss the same content every time. Okay, so that's about it. That was my last question. I hope you guys liked that PowerPoint. Good night. If you need to email me anything, just email me. Bye, guys. Good night.